postpone the thought. So these are good coping mechanisms. Now, along with good coping mechanisms, people also have not so good coping mechanisms. So when someone is under a lot of stress, they may resort to taking alcohol or other illicit substances like cannabis and other things. You tend to smoke more, hoping that you'll be able to forget about this. But it's actually the reverse that happens. Now, certain substances, if you're feeling low, although you think will make you feel better, actually has just the opposite effect. Some people harm themselves, might cut themselves just to release that anger. Another way would be an unrestrained display of feelings, which is good in one way. You lose a close member of the family and you're crying. So that is one good way of displaying your emotions. But another damaging thing could be being angry at the doctors for not treating the person properly. So if the person died of a medical condition, you can be angry. You might be angry with the doctors for not taking proper care. You might be angry with your sibling for not doing what should have been done. Again, another maladaptive coping mechanism is aggressive behavior. So someone's done something wrong to you, you're highly stressed, you try to harm that person. Not only verbally being aggressive, but physical aggression as well. So these are not very good coping mechanisms. So people with such, when people have issues, if you can't sort it out, then you should resort to counseling. Sorry. Now, what I would like to also highlight is counseling is a professional service. And sorry, someone raised the hand.
No, sorry. I'm sorry, my mistake.
All right, okay. So it's the difference between counseling and helping skills or making use of counseling skills are two different things. So counseling is a managed activity. It's in a sense a sort of a therapy. While helping skills could be, a friend comes and tells you, I've got this problem at work, what do you think I should do? So you just have a chat, but that is not technically counseling. You're making use of counseling skills, but that's a different level of things. So in proper counseling, it's a managed activity. Managed as in you come into a contract with the client. So the client comes to you and you have to set a time, maybe a time, a date, and probably a place where I'll come to later. So you get into a contract maybe. And of course, confidentiality has to be maintained. So someone comes to you with a problem. Now, that doesn't mean that's going to be discussed at your dinner table or with your colleagues at some point. No, what is discussed there remains there. It doesn't go out. And of course, as I mentioned, it's a professional service. You could charge a fee or you may not. Now, something about counseling is you do not offer advice to the person.
Oh.
So advising people is sort of a helping skill.
Okay.
During a friendly chat. So I'll tell you how we come about helping people. So it's not advice giving. You have to have that in mind when you're actually counseling. So who are the people who will benefit with counseling? So people with mental health issues, relationship problems, with so relationship as in, not just your spouse, but maybe your other family members. Making career choices, also people will benefit with some counseling, or issues at your workplace. Interpersonal issues, yes. Management of stress, again, counseling helps. After bereavement, some people don't go through the normal bereavement process. So some people do need a little bit of help. So counseling helps in that sense. People with substance misuse who want to give up, they want to stop smoking, they want to stop alcohol. So then again, counseling comes into use. So these are people, some of them. Now, this is not an exclusive list, but these are most people who come there, come to you as a counselor would have some of these issues. So what do we aim? What are our goals of counseling? What do we hope to achieve at the end of it all? You guide them. You also give them emotional support. That's a huge strength to them. And you discuss solutions, which could be psychological and emotional concerns. So you discuss solutions, but at no point will you be giving them advice. So I'll be talking a little bit more about what you have to keep in mind when you counsel someone. So how does it help? Does it help at all? Well, most of the time it does help. So it helps bring about self-awareness of this person, of your client. So person might be very, not a very assertive person. So is unable to say no and gets down to doing all the menial tasks. So during this counseling process, the person can be made aware of what is happening. Is it that you're not being assertive enough? And then you can deal with how do you become more assertive. Some of them will need emotional support. Loss of a loved one, how do you deal with that? Issues with another colleague or family member or relationship issues, how do you deal with that? So how to manage the challenges, how to manage stress. And of course, enhancing the at the end of it, the personal development and growth of the person should be enhanced. Also, at the end of everything, the person has to be empowered, not to be dependent on you and to keep coming to you regularly. So after the person is counseling will not finish in one session. As I said before, you have to set dates and times and reviews. At the end of it, the person has to be empowered and not become dependent on this. So you get all types of counseling like career, marriage counseling, family counseling, trauma counseling after traumatic events, maybe after a road traffic accident, even witnessing a road traffic accident or, some natural disaster. People might need counseling. Grief counseling is another type, addiction counseling. So all those are types of counseling. So when it comes to counseling, doesn't have to be just in person. You could, of course, I think having a face-to-face chat with someone is better. The interpersonal relationship helps, but sometimes it's not feasible at all. So then in which case, telephone counseling can also help. Now, some people prefer that type of telephone counseling so that they don't really have to face the counselor in a sense. Of course, video counseling is another way out, which is also good. And these are types of individual counseling. There's also what is called group counseling, which in certain instances will be far more effective. So a group should ideally consist of a small number of people, maybe 6 to 8 people, and you have to they have to have the same problem more or less. So addiction counseling, group therapy is good. Bereavement counseling, again, group therapy is good. So these are different methods of counseling we come across. So if you want to be a good counselor, you have to have very good listening skills. You have to be a good listener. You have to have empathy with the person. This will help the client to ventilate his emotions properly and also begin to trust you. So listening would be, both attentive listening is what has to be done. So yes, go on, tell me a little bit more about that. You have to show them that you're being attentive at that point. Another thing to remember is you have to be non-judgmental. In no instance can you judge the person who comes to you. They'll come with horrendous things, some things which you never heard of before. Right? So sexual things might be brought in, you may not have heard of. It might be going against your religious views and your personal beliefs, but you have to always remember you can't bring yourself into that picture. Yeah. So your beliefs and religious views, political religious views, have to be kept aside. You have to be consciously aware of that because we are all humans. Someone comes and says, I've been married for such a long time, but I've had an extramarital relationship with my spouse's good friend. You may know the person as well, but at no point should you say, my goodness, how can you do that? That type of thing. Someone says, I feel like harming myself. I did harm myself. You just listen. Not that you agree with them, but you listen. Listen actively. So that is something which you have to keep in mind, not to be judgmental. And of course, you have to be able to facilitate the client to be aware of their own emotions. So they may sort of say, no, I'm not in denial. They've lost someone, but they pretend as if the person is there. So you have to make them aware of their own emotions. Help them to accept the problem. And what you're trying to do is help adjust with it and try to be independent. So we have to also be able to facilitate and focus on the strengths of the person, because each person has positive strengths. They might come in a vulnerable state to you, but each person will have different strengths, which we could make use of to bring something positive. So you should encourage that as well, which in turn will reduce the negativity of that person. So the person says, I just don't feel like doing anything, but he's very good at teaching someone. So you make use of that and say, okay, as one way of getting out of this is you can make use of your teaching skills. The person is low and say, okay, you can make use of your teaching skills to teach someone something you know. So that brings about something positive. The person who said, no, I just can't do anything. I want to stop this and go somewhere or give up. I've given up. No, so you can make use of their strengths and bring something positive out of it. So as I mentioned before, the patient has to feel safe with you. So you have to be able to maintain boundaries, not be judgmental. The environment also has to feel safe for the person, not just yourself, because at the end of the day, it's just yourself and the client. It could be one of the same sex or a different sex. So right now, these gender-based issues are also coming up. So you have to make sure the person feels safe, and you have also to feel safe in that environment. So to identify the problems, understand issues, develop strategies, offer them emotional support and guidance, and not advice. So still, a counselor should maintain boundaries. You have to have strict ethics. There are ethical laws, ethics when it comes to counseling. Like there's something, you could tap someone is feeling low, you could offer a tissue, someone's crying, you could offer a tissue or just pat the person on the arm. But again, you have to be very careful depending on the cultural acceptability as well. Now, someone who's abused, you might not want to touch the person because they can have flashbacks of what has happened. So things like that also come into play. And as I mentioned before, what is discussed here stays there. It shouldn't be discussed at a party, socially, or at any point or place. However, breach of confidentiality can be done in certain instances. For example, the person says, I'm feeling suicidal. What do? Well, right at the beginning, you have to tell them, if I think your life is at risk or life of someone else is at risk, then I have to breach confidentiality for everyone's safety. You have also to know about the laws and legislation in your country. And as a counselor, you're taking a whole emotional burden into yourself because you're also human. So you need constant supervision because at one point during your counseling session and subsequent counseling sessions, some of your emotions might also come out. You might feel very annoyed with the person. You might not be able to show the same empathy you wish to show. There can be issues like that. So it's always best, and what is recommended is for you to have supervision on a regular basis with someone. You can do a group supervision or individually with another senior person or another counselor who can supervise you. That is very important because otherwise you take with you some things which were discussed here in this room. So, for example, you were counseling a couple. If you don't leave it here in the counseling session and you go out, these emotions might come out with your family members. So what is discussed there should be left there. And if you are having difficulties, also it should be discussed with your supervisor. Whether you have difficulties or not, sometimes you may not recognize them. Supervision with another counselor, a senior counselor, is of paramount importance for your well-being because you have to be well to be able to help someone else. So now I've made this counseling very simple, but it's not as simple as I make it out to be. You'll understand when you get down to doing this. So I've broken it down into 6 steps. So first is identification of the problem. What's the problem you are having? So it could be one problem, it could be many problems. So say, for example, I have issues with my colleague. So what is the problem? What is the issue with the colleague? He doesn't finish his work on time. So what else are your problems? Do you have any other problems? He doesn't finish his work on time. He comes late for work. I'm not able to tell him anything. So what is the main problem? You might have many problems, but you identify the main problem and put it into a hierarchy. So next, you take each problem. You could start with somewhere in the middle or start with the most difficult issue the person is having, not what you like to do. You see, that is very important. Here, as I mentioned before, we are trying to empower the client. So you have to be very conscious and not pick the problem you like to counsel the person with. You put it to him. So that is empowering the person. So you discuss the possible solutions, the pros and cons. Okay, I can tell him to finish his work on time versus what else can I do? I can hand it to, if he's not able to do it, I can hand it over to someone else. So list out the other possible solutions. Give him less work. Is that possible? Ask him to stay on for a longer period and finish the work. Break it into chunks. Is he having problems? So listing out possible solutions. Then now listing out the solutions, two should come from the client. And once the person comes up with it, with possible solutions, you can also suggest other solutions. And then now you weigh the pros and cons. So then what you could do is get the client to select the most suitable or most practical solution. So we came up with so many solutions. What's the most practical solution? Probably getting someone else to do for him to share the workload with someone else. And once you do that, how are you going to carry out this best solution? I found the solution. How are you going to carry out this solution? So we'll have to recruit someone, which might take time. Or someone else who doesn't have much work, but is also capable of doing whatever, can take on some of this thing. So once you decide on these, then you fix a date to review. Now the person goes back, we'll try to sort things out, and then come back for a review. The review date and time has to be set with the client before the client leaves. So I'll see you in 2 weeks' time. Let me know how it goes. So those are the basic principles or steps in counseling. So identifying the problem, making a hierarchy, assessing each possible solution with the pros and cons for the problem, listing out all possible solutions, selecting the suitable or most practical solution, planning how to carry out the best solution, and the review. Now you're there just to guide them and to empower them. At no point should you bring out your views or beliefs into this. Because at times you may feel, oh my gosh, what a lousy decision to make. So that's why we discuss the pros and cons with the patient. So that's in a nutshell the steps in problem-solving counseling. Now, easily said than done, it takes time and all that. Being a counselor can be very challenging. One thing is, we have to respect the client's decision. At times you may feel, as I mentioned before, what a stupid decision to have made. But still, say for example, the person is being battered by the spouse. She makes a decision based on all these pros and cons to go back to the spouse. So you have to respect their decision, however much you think it's a stupid decision. The responsibility is given to the client. It's not easy to improve the self-efficacy of the client also. Now, sometimes we don't want to let go of the client. You think you have failed. So you have to be able to recognize up to what extent you can help a person. So that is also important to know up to which point you can help someone. there can be mental illness. So if someone is not really improving, you have also to think, is this because of a mental disorder? Does a person need something more than counseling in this instance? Now, someone who's depressed might come to you because, I mean, most people come see, would like to see a counselor before seeing a psychiatrist or a psychologist. So you have to be able to think, could this be mental illness? Is that why I can't? So you have to have a rough bit of knowledge of the certain mental disorders like depression, schizophrenia, things like that, mania, hypomania, certain disorders, anxiety disorders. You have to have a rough knowledge. It's under no circumstance would you be diagnosing. It's just thinking, is this a possibility? Because you might be counseling them, you'll see them 3-4 times, but it's very stagnant there. Because say, if, for example, someone is depressed, they're not able to take things in. Their concentration is poor, their focus is poor. They're not able to absorb and have this discussion with you. So it's very important to identify this. So identifying the possibility and referring is very important. Now, sometimes you may see a couple for counseling. Now, you have to not take sides. You have to be impartial. That is very important because subconsciously we may take someone's side. And especially when you do couple counseling, you might see each partner separately before you see them together, or you see them together, then talk to them individually, and then do the therapy together. So there might be something which the other party doesn't know, which might, bring about unnecessary emotions in you also. So you might, without you knowing, take someone's side. But you have to always remain impartial. So that's why it's good to always discuss with your supervisor certain cases, but of course, maintaining confidentiality. You don't reveal the name and things like that. That's important. Finally, you shouldn't make your client dependent on you. It's nice when you feel nice when people want to come to you and seek help, but you have to make sure that that doesn't happen, that they are able to function on their own. Idea is to empower them, not to be dependent on you. Because with certain personalities too, there is a possibility of them getting dependent on you, especially if they're, very submissive people who have dependent personalities or histrionic personalities might become dependent on you. No, you feel good because someone is looking up to you in a sense and wants to come and talk to you. And you feel good that you're helping, but in the long run, you're not actually helping them. So those are the challenges of a counselor, and these are things. This is why you have to always have supervision after your counseling session. After a few counseling sessions, because you won't be seeing one person, you'll be seeing many people. So it takes a toll on you. And because it is important to discuss all this. What effect it had on you after counseling someone? How did you feel after that? Do you feel drained, or do you feel okay? Are you able to leave it behind? So that is important. nagaRAJU, do I have time, or?
Yeah, please go ahead. We have plenty of time.
I have a small video clip.
Yeah, please play it.
14 minutes, but I'd just like to show you, just a little bit of this clip.
Yeah, yeah.
Good afternoon. I'm Dr. Ruini. Please have a seat.
Good afternoon, doctor.
May I know your name, please?
My name is Hirosha.
Hello, Hirosha. Whatever you say will be kept confidential with me, Hirosha. So you can feel free to talk anything with me. And can you please tell me what brought you here today?
Doctor, I feel very upset. I lost my job 2 weeks back. I was working as a supervisor at a leading garment factory. Actually, I am a good worker. Most of my superiors knew that my work is good. However, I used to go to work late, doctor. It happened many times. And they were warned me on several occasions, but I couldn't change it, doctor. They gave me a lot of time to change, but I couldn't. After that, I lost my job.
I'm really sorry to hear that you lost your job, Hirosha. And what are you doing right now?
Nothing. I'm not working now.
Okay, so you are not in a job these days, right? So can you please tell me how you are coping with this problem? How is your sleep and how is your appetite?
The first few days after lost my job, I felt very upset. I couldn't sleep, I couldn't eat, I felt hopeless. But now I feel I'm getting better, doctor.
Okay, it seems that your sleep and appetite is improving now, right? How do you feel now?
I think I feel better and I have a lot of courage because I have 2 kids, doctor.
Okay, so you have 2 kids, and how old are the kids?
The elder one is 13 years and the younger one is 10 years old. Both of them are girls and they are schooling.
And do you get any help for your daily hassles at home from anyone?
No, doctor. My husband is not helpful. He is taking alcohol even when I was working. When I go home after work, I have to do all the things. I have to help the kids, I have to clean, I have to cook and all. So I'm fed up of this. So I go to the bed very late, doctor. I'm really tired. Then I used to go to get up late and ended up with losing my job.
Okay, I understand the situation. Don't you get any help from your kids for your daily work at home?
No, doctor. Now I realize my weakness deeply, doctor. Actually, I can allow my kids to do their own works alone.
Yeah.
They are not kids now.
Hirosha, it's really good that you realize your weakness. Okay, now let's see. As you think, what is the most important and the most urgent issue that need to be handled first among the problems?
My first priority is finding a job, doctor.
Okay, as you think, the priority is the job. So that is the most important and the urgent issue to be tackled first. Okay, let's see how we can do this. And for that you have to think about the possible options. It means to find a job, right? Your problem is finding the job. You have to think about the possible options to find a job. Okay? Then it's nice if you can write them down on a paper. So you can bring it at the next visit so we can discuss about options too. Okay?
Doctor.
Okay, let's see when can you meet me next?
Could you please give me an early appointment, doctor?
Of course, Hirosha. How about next Monday by 2 p.m. at the clinic? Is it alright with you?
Okay, doctor. Thank you very much, doctor.
Thank you, Hirosha. Take care.
Right. So you would have seen at the beginning how the patient was made, the client was made to feel comfortable, and she laid down the rules about confidentiality, all that, and how the problem solving started, how she asked the patient, well, what are your problems? What are your concerns? And what are your possible solutions? So person has to think about it. the solutions are not going to come out immediately. So someone has to take time and think. And that time given to the client to think helps a lot. Is that okay? That's all I have. I'm happy to answer any questions or queries.
Excellent, Professor Dulshika. I think that has been a very, very, very insightful and quite extensive talk on basics of counseling. In fact, I was under the impression that counseling and advising are the same. Maybe the word misled me. I thought counseling is typically interpreted as an English word as advising, and you have cleared that. And also, you have made quite a lot of very, very useful inputs to us. And this will help us in case we design a program to help ourselves. I think there are some hands risen. Srinivas, do you want to say something?
Dr. Waas, see, the difference between a professional counselor and we as Lions getting trained as counselors is we start empathizing a lot with the person whom we are counseling. And if we get too involved, it can take a toll on us also. So how do we be detached so that we stick to only counseling without getting involved? That is a challenge.
See, when you undergo, you will have to undergo a certain amount of training. Now, we unofficially counsel people, have a chat with people, but that doesn't really amount to counseling. It's just befriending in a sense. But I think what you have in mind to do is something different, isn't it? A little bit more than befriending people. Am I correct?
See, I said detachment. How do we detach from the client?
So you leave it there. You leave it then and there. You think, okay.
We should not empathize or sympathize, but be objective and professional.
Yeah, you do have to empathize with the patient. You are feeling you're crying, or it is making you feel sad. I understand. But once the client leaves, you have to think, okay, I'm so and so, this client has left. I might be feeling this, but it has to stop now.
Yes.
Have to leave it
I
there.
think we have to draw a line and do it. Anyway, your presentation was very analytical. More than a doctor, you are sounding like an engineer. Step-by-step presentation. Thank you very much.
Ashok, did you have a question?
Thank you.
Good evening to everyone. Ma'am, I have one simple question. You have told in the initially that not to give advice, but on the other hand, you said that guide them or show them the path to come out of the mental stress. So how do you differentiate both of them? And the second one is that when sometime the ladies persons come for the counseling, they insist on privacy. But sometimes it may go on for the wrong things. So is it possible to record audio or video sessions for particular that time? Thank you.
I'll answer your second question first. When you do record a session, you have to ensure those things are kept with you. No, you have to inform your client that you're going to do that. That's one thing. Because other thing is sometimes you have someone else in the room, in your consultation room. You could have that as well if you are feeling very uncomfortable. Or you could have say the door open, but ensure there's no one out there, or someone who's not another client hanging around there. So those are ways of overcoming those. But if you do feel uncomfortable, you have a right to say, well, I think it's a bit difficult for me. I'd like you to see someone else, and refer them. Because you do get, this will happen in time to come. You do get people who come for different reasons also. And then that goes down another path, there is legislation, and that becomes a big problem. So your first question on advice and guiding them, You don't tell them what to do. You facilitate them. That's the difference.
Yeah, the video very clearly proves that.
Thank you very much, and congratulations. Very excellent session. This is step-by-step guidance. Thank you.
Thank you.
Dr. Dulshika, in case I want to call myself a counselor or become a counselor, I mean, I don't know the legal or the academic qualifications that I need. When can I call myself a counselor? At what stage?
It's like this now. You have to look at the legal aspect of things also. If by chance something doesn't go right, you can always be sued by the family.
Yeah.
You know, it's a rare occasion, but it could happen.
True.
So I'm not sure what the legislation is in India now. Like now here in Sri Lanka, we have psychotherapists, psychologists, counselors have to register with the medical council here. Mm-hmm. But of course, you get people who put up boards and who do a little bit of counseling and call themselves counselors. You can have paper qualifications, but I suppose there might be training programs also.
I see quite a lot of people who call themselves counselors and speak in public and claim lots of different kinds of achievements. And unfortunately, quite a lot of them spill the beans in public meetings and they say somebody came to me like this and they had this problem. I solved this problem. And when I hear, I feel a little uncomfortable when they speak about this kind of achievements.
Exactly. So confidentiality has to be maintained. We are also human, and you know, if it's in a small area that you're meeting people, that you're sort of counseling, there's a high chance of you knowing them and knowing so and so. So you have to be very, very cautious.
Yeah. While counselors can market themselves with their qualifications or whatever, but I think they should not publicly talk about the people that came to them or the solutions that they gave them and these kind of things, I think.
I agree, yeah.
Yeah, any other question, please? Yeah, line Manoj Purohit. You can unmute yourself. Line Manoj, if you have a question, you can unmute yourself.
Am I audible?
Yes.
Am I audible?
Please speak.
Yes, I can hear you.
Can you just point out the difference between peer counseling and professional counseling?
As I mentioned before, peer counseling is like befriending. You're making use of counseling skills. Like a colleague of yours comes and asks you for, you know, I'm in this problem, what do I do? So whilst professional counseling will be at a different level, where they'll go through all the steps, look at the whole picture. So peer counseling is making use of counseling, but not in a professional way, more or less. It's befriending, you're giving them advice. It might be over a meal or whatever as well. It's like, you know, you're having a chat with a friend of yours and proceeding.
Can counseling sessions be recorded?
You have to inform your client why you're recording. You have to ensure that the recording is kept safe and no one gets hold of it.
Yeah.
And, you know, those things are very important. And keep it safe, ensure there's safety. These things can leak out. And you know, you have to inform your client at the beginning that it won't be, confidentiality will be maintained and no one, even if someone asks you, especially when there's couple counseling, they're going in for a divorce or whatever, they may come and ask you for it, but under no circumstance should you be giving it to them or to any other person. So ideally, it's best not to record, but it's good to keep a few notes. Again, confidentiality will have to be maintained. Security of those notes will have to be maintained. So keeping notes, short notes, because so that you can recall when they do come for the review. So that's done. And you sometimes for training purposes, what we do is we tell the client, can we record this for, to discuss at supervision, so that your supervisor knows exactly what's taken place, especially if you're, having trouble dealing with it. So you could do that, but you have always to be open and ideally get written consent when you're recording it, and ensure it doesn't go on social media and things like that.
Thank you very much, Professor Dulshika. I think it has been quite an illuminating talk, and your presentation is very, very lucid. And I think the pace at which you presented is phenomenally beautiful, remarkable. It's wonderful, actually. I think we felt like sitting in a classroom and then listening to you quietly. It was really, really very impressive and wonderful. Thank you very much for being with us. And maybe we'll trouble you again in case we decide to launch this course. Maybe we have to help us with designing some basic curriculum for this program. Maybe I'll often trouble you.
All right. Thank you. Thank you very much for inviting me.
Thank you.
Okay. Have a good evening.
Good evening. The others can stay back for some time. Professor Dulshika, you also can. She has left, I think. So maybe now that the talk is over, all of us, please unmute yourselves and then be on camera and tell me how we can go about from here onwards. What shall we do? Shall we go further than this, or shall we stop here?
Sir, we need to go further from this. This is only an icebreaker. And we need to, like what PhD line Narendra Bhandari said, hundreds of lions have to be trained in counseling. To train them, we should get trained. If we get trained, extensive, like what was suggested, a 2-day training, a brainstorming training, we should undergo, so that we percolate it down to grassroots lions to take it forward. Identify grassroots lions who have the aptitude and attitude to train, and then take it forward. That is my suggestion.
Thank you.
nagaRAJU.
One or two people asked me, why should it be limited to LCIPs? Should we not invite others? What I told them is that for the time being, we'll begin with LCIPs only. And in case the program is successful, and if we are happy with the outcome, perhaps in course of time, in future, we can open it to others. All this is what I said, but subject to approval by all of you. Ashokji, you can.
nagaRAJU. nagaRAJU.
Yes, please.
Can I come in?
Please go ahead.
See, first important thing we all should understand what the speaker has told us. I think there's disturbance, I think.
I have muted. Yes, go ahead, please.
Yeah. See, we need to first understand that how the program we want to take it forward. Okay. So first of all, I think this is one particular session, we got an, I would say, overview of what counseling is.
Yeah.
And that gives us confidence. And the last line of that is the most important role of a counselor is to empower your client.
Very important.
To release their problem.
Yeah.
We are not giving solutions. The counselor is not supposed to give solution. Right? That is what I understand from the entire presentation. So that gives us confidence that we are not providing solution to the person who is coming to us. Right?
Yeah, yes.
Now, number two, we are going step by step. We are not directly going into a professional counseling. Right? We are trying to help the community, or if we identify some people with mental illness, we are voluntarily going to approach that person and try to, help him or empower him, make him more confident to solve his problem. I understand from this presentation, right?
Yeah.
So unless and until we go one step further, like this was an overview of the counseling, if we go into a proper training for 2 days to be a counselor and then test on ourselves with few cases, if we are able to help somebody in the community. Once we are confident about one or two such cases, then we can plan further to train more lions to be the counselor. Our ultimate aim is to prepare more counselors to prepare to preliminarily take the challenged people in the community. If I understand, or that is what I was planning, see, let us prepare hundreds of lions in the country to be, addressing challenges in the community with people. And definitely, once we have that, we can also talk to the professional counselors or professional psychologists to be a support to our team. If we have 15, 20 counselors ready, trained, and try to, practice counseling, not practice, but to help the community do this. And we will also try to attach few psychologists to be our, what do you call, mentors, or maybe, what do you say, to help us if any challenges come. So when we get trained, we should be confident that in a challenging situation, very extreme, we have somebody to support us. That is how, if we proceed, I think we will be able to take our program. First of all, let us all be confident that yes, we want to go ahead. After being trained, we will also analyze ourselves how far we are good at doing so and so thing. And third step, we will practice with some people in the community, and we feel that yes, the people whom we have done counseling are quite happy about our helping them or empowering them. Then we'll go into training more and more lives. Step by step, we will go. I think that is what I was proposing. I have let others also give their input.
Yeah. Ashokji, do you like to say something? You raised your hand. Ashok Misriji.
My say is that we should plan in coming to 3 months, 3 or 4 days vigorous training for ourselves for this mental health well-being as a counselor, and to learn all the techniques and everything. So then we can impart that knowledge to our through Lions Club to the community. So we should think of having this training session within coming 3 months as early as possible, at least for 3 to 4 days, a rigorous training.
Thank you. Nabilji, do you like to say something?
Yes, good evening.
Good evening.
Thank you, nagaRAJU, like always. It's a very, very, very amazing and empowering session. Personally, I have, since a long time, I have participated. But if it is a program or a training formula for dedicated for Lions, I'm not sure if it is our mission to be we do this counseling all the time for our fellow Lions. It is like being our habit, more or less. If it will be for outsiders, for non-Lions, the lesson design, the scope should be clear when planning the lesson design. That we are preparing ourselves to what? So expectation should be very clear because it's very professional and there is a huge responsibility upon the shoulder of a counselor.
You are right, because what we have already been doing is only out of experience and also the goodwill that we have, but we have to become professionals and we need some training for that. Vijay Kumar Shetty?
Okay. Yes, sir. Thank you very much. Good evening, everyone. I was driving
Please
all
switch
the
on your
way and
camera.
hello.
Can you please switch on your camera?
Yeah,
Okay, please go ahead.
sir. After hearing this session, I think we should train as counselors. Basically, because we have a lot of schools, adopted schools, or we have our own schools. First, we should start with the children, counseling to the children. So that should be a basic training for us. That should be the training for us, so that we can do some moderations, and we can improve their career guidance like thing, so that it will help our community to develop something. Later on, we can think of counseling the other lions or lions outside our community. So first basic thing we have to do is train ourselves to counsel our children of adopted school or our own schools. That is my point of view, sir. Thank you very much.
That's the idea behind this. To train ourselves is the idea behind this. Kampanageshwar Rao.
Sir, good evening, and really very happy. And first of all, I request you to please share the recording of today's video so that we can watch 2 or 3 times also. And then number one. Number two, I would like to support in this regard because I know all these psychologists and the vice president of Andhra Pradesh Psychology Association.
Wow.
Also founder of Telangana Psychology Association.
Great.
And I can help you because I'm a practicing psychologist since so many years. And I have so many people, and even our own lines also, good psychologists are there. Previously, Pattabhira was there. I explained now GC Kavita, extraordinary psychologist. She is now
We invited
professional.
her.
We can take help her like that. And she's already having some courses. And like that, the basic skills and basic courses, basic therapies, basic we can learn so that we can use in our training and our mass. What I'm doing in my regular classes, I use all therapies only, but in simple language. Like that, we can use this only. I would like to support in this regard.
Thank you. Thank you very
Right,
much.
Right, sir. Right, sir.
Yeah. Anyone else? Srinivas?
Bangalore has Asia's biggest mental health center, NIMHANS. So we can rope in a lot of, there are clinical psychologists and non-clinical psychologists for different applications. So we can take their help for training. So that is, I wanted to suggest that to you.
Thank you. I see Shaina there. Shaina actually had conducted a program some time ago with Dulshika, and that's how I came to know her. I heard her that day and I liked the presentation, and so I invited Dulshika. Thank you, Shaina. It was a brilliant talk. I think you're not there when she spoke. It was really very illuminating, very useful to us. Anyone else? Okay, maybe if we have to consider the future steps, let's discuss the possibilities. One, it can be a completely online program, or it can be partly online and partly offline. So which do you prefer?
We prefer a physical interactive session, which
Yes.
we can all participate and learn something. Online has its own limitations.
Offline, in-house.
Yeah, can we have a few introductory or preliminary online presentations followed by maybe a physical program? Will that be better?
Sir, yeah, online also okay, sir. But when we do practice, we need to go for offline only.
Yeah.
So the concepts we can learn through online. But when we use practically, there should be a demonstration. Everything will be then psychotherapy that we need to do in physical only. So let's have a 10 days or 15 days online sessions, and every 15 days one therapy. After completing that, we can meet. We can learn only basics, sir. Otherwise, it is a huge course. Basic psychotherapies we can learn.
Correct. Correct. So in case we want to make it offline also partly, so we have to identify a proper place for that, and we have to travel there, and all of us have to stay there for 3, 4, 5 days, whatever is the length of the program, and it will be expensive naturally. So what place would be ideal? Hyderabad, of course, is available. I will take the lead in case Hyderabad is convenient, but others also can come forward to suggest more convenient places.
Sir, nagaRAJU sir, my suggestion is let's start some therapies with online.
I see.
Which are, for example, CBT, cognitive behavior therapy, that we can teach and learn through online.
Okay.
How to use, that's all we can do. Like that, so we have some therapies. They can go like that, sir. Online is also, we'll start using in our training, sir.
But
Start
is
using in
psychotherapy and counseling, are they the same? Psychotherapy is slightly different, I think. That's
sir,
what I'm told.
yes, sir. Counseling, what we use the word, sir, regularly.
I see.
We use the what the therapies and the psychiatric therapies, psychiatry is medicine, sir. Psychotherapies are the only therapies what we use. For example, cognitive behavior therapy, CBT. Like that, we can use it. We use in counseling only, all that.
I see.
Sir, we are all laymen in this, very little knowledge we have in this.
Correct.
So it is better to, like how Doctor today made a presentation step by step, from foundation to plinth to
Yes, sir.
structure to finishing. So let us go in that order. As an engineer, I can talk that language only. So I would always prefer a session, and Hyderabad is okay with the last two LCIP FDA refreshing session we did in Hyderabad. Excellent, very well organized. If everybody is okay with Hyderabad, I'm okay with Hyderabad.
Yeah, we'll. I
Done,
think
sir.
you can write
We'll
to me
under the
later
leadership of
also.
nagaRAJU, we are all there to support and organize also.
Yeah. Right, there are two advantages in doing it in Hyderabad. One is the National Institute of Mental Health is located in Hyderabad, All India Institute. And there are many universities here which have psychology departments, and we can take their help also. Maybe other cities also have similar facilities, but
Bangalore
National
has,
Institute.
but Hyderabad is a better option, I feel.
So maybe we can begin by thinking of some steps. Step one, we can have a few online sessions during the next 1 or 2 months, maybe 2 or 3 sessions every month. And after that, maybe sometime in the month of January, February, we can plan an offline program in Hyderabad or in any other city where we have the best facilities. We will continue discussing this. Everybody can contribute ideas, and we will take a, decision based on opinion of members. In case we decide to do it in any city, Hyderabad or anywhere, because it's going to be it's going to involve travel, accommodation, and all that. We all have to be ready to pay for that, and I think there must be some kind of a certification also attached to it. It can be a very academic kind of a certificate from the institute that conducts it, or maybe we can design our own certificate and then we can give whatever is best suited, so that I think we'll have something to rely on when we finish the course.
Yes, sir. Something in lines of what we did for LCIP FDA refresher course in Hyderabad. Something similar to that we can do, sir.
Yeah.
And here the participants will be minimum 20 to 30, that's all. It will not be,
it should not be long.
It should not be more, so that we can, it will be more involved and more, what to say, more interesting and more learning it will be.
Correct. It will be limited to a maximum of 25 people on first come, first served basis. And for the time being, it will be limited to LCIPs. And in case we successfully finish this program and we organize one more program like this, maybe a little later, perhaps we can consider others. For the time being, only LCIPs. That's my idea.
Done, sir.
Even we can design on the path of our what training we get in during LCIP. That way, 5 people, one group, and
what
then
we can do, nagaRAJU,
sir,
I think we should start talking to some institutes of psychology, some university, maybe in Pune, maybe in Hyderabad or anywhere. Once we get some good support from any of the university, then if you want, I will talk to LCI also and try to get a combined course.
Wonderful.
So that the certificate will have both the
great.
Maybe some sort of approval from LCI as well as the university.
That will be excellent, sir.
So if you want, we can start talking to some university.
I've already started speaking to a few people that I know in Hyderabad, and I've requested them to help me design a curriculum. So we are working on that already. I'll share it with you as soon as it's ready.
And if any of our participants are attached to some university or psychological department, even they can also try. So the best certification if we get, and after getting that certification approval, If we talk to LCI, that will make more sense.
Yeah. Correct.
So let's start talking to some university or something which can give certification.
Sir, I will support you, sir, nagaRAJU garu. I know some universities, nagaRAJU University is there. Can give you certification. Already one course is there, which certification course.
I see.
But that is 6 months diploma, 6 months. Even today also is this course is there.
Yeah, there are some courses on Swayam also. Swayam portal also has diplomas, but because this is exclusively meant for Lions and LCIPs.
This is the certified by university, na sir? nagaRAJU University.
Swayam is I think, national portal. Government.
Yes.
Swayam is the highest body. The best.
Yes, sir. Yes.
Fine, go ahead, nagaRAJU. Once we are prepared, let's start working positively. See, let's keep an aim by February. We want to have this offline program. If everything goes on well, we will have it. Let's keep on discussing on this.
Thank you. So shall we have a few more sessions like this during the next 1 or 2 months?
True.
Please, sir. Please carry on, sir. Like this.
nagaRAJU, sir, if you want any help in designing some brochures or some like that, I'm always ready to assist there.
Thank you so much. Thank you. Thank you, Ashokji. Last time also you helped us a lot.
nagaRAJU, if we have 1 minute, I wanted to make one appeal to our all LCIP participants. Now that Hunger Week is coming up, in January 3rd to 11th. So I trust that if we can have the similar session as we had for mental health and well-being, maybe on nutrition or whatever it is, we can design at least 4 or 5 sessions. And if our LCIPs are prepared to make presentation, we should take up that program again.
Sure, sir.
So we can make a small appeal.
Somebody by name Raju attending this program. Who is that? Because we have shared the link only with LCIPs. I don't know who this Raju is. It's okay, right? Sir, we'll work together, sir, for that Hunger Global Week.
Yeah. Sir, for this hunger relieving, nutrition has to be a part of it, because only hunger relief per se is not going to help, because the people don't get proper adequate nutrition. There is a lot of vitamin B12 deficiency, vitamin D deficiency, calcium deficiency. So how do we help to supplement all this for people? That also we should make an attempt.
Hyderabad has National Institute of Nutrition, NIN, and it's a very, very, very famous national body. We can rope them in case we want.
Yes, we can take their guidance also, what has to be done.
Okay, I think we can stop the meeting here and then we'll get back to you. We'll continue discussing in the group, LCIP SAME group, and please contribute your ideas and then participate in the discussion. So the meeting itself is over and we can be here for a few more minutes to just say hellos. Nabil,
yes,
how are you? Nabil, after a long time, we are meeting you after a really long time.
Yes, you know the situation I was facing the last 5-6 months.
I know.
Thanks to God, it's gone now, and I'm regaining again my habits and my daily duties.
Good. Very good.
Now we have the challenge of Mission 1.5 on our shoulders, so it's a huge task.
Yeah, heavy on our shoulders. Who are all coming to Isame?
Yes.
Ahmedabad? Oh, everyone. Sairam is coming, Amar is coming, and Nabil is coming. I am going.
I'm also coming, sir.
Great. Gampa is coming. Good. Ashok is coming. Quite a lot of us. Good. In fact, one of you
You know, if there is something special, like a small gathering, small meeting, like a sit together,
correct.
for this this friendship to continue and grow.
We will, I think one of us can ask either Praveen Chatterjee or somebody in Ahmedabad to give us some time to sit together, all LCIPs from Isame area, and we can have some an informal discussion, and we can also discuss this concept of this counseling basics further. Who will take that lead?
Who is better than yourself?
No, I mean somebody close to Praveen ji would be better, I think. Talk to him.
I don't know personally.
It can be an informal meeting if they just give us some space. And
Yes, let it be informal. Let it be informal.
Or one of us can even make a track presentation on what's happening. So you can, one of you, any one of you can make a 20, 30, 40-minute presentation on this idea that we are promoting.
It's good. It is a good idea, but I'm not able to prepare for to be well prepared for the ISAMI. I have too many things to reach.
Jayanti is a good choice, I think. Jayanti can make that.
Oh, the best choice.
Jayanti, you're muted.
Actually, sorry, you know, there was my DD's official visit to my club. So I was there. I just came out of there
It's
just
okay.
now. So I didn't listen to most of it.
No problem.
Next time I'll take part.
No, we are asking you if we can take the lead to organize an informal meeting in Ahmedabad, the LCIPs.
Actually, you know, I am out probably, outside the country also in December.
Okay.
All through December, I am out. I'll be visiting my daughter in London. So in between the lines program, before the forum, so before and after the forum. So that is a lot of time will be wasted for me.
Okay.
So after that, I can. Okay.
Sure.
Thank you.
Shashi, we are seeing you after a very, 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 very long time. I think you've not been seen even on that Skill Up programs. Shashi, do you like to unmute yourself? Actually, Shashi also wanted to speak during those Skill Up programs, but he could not make the presentation. Habibji, are you ready for the Skill Up next week?
Habib is always ready.
Yeah.
He is our GLT coordinator this year.
Oh, I see.
And the year to come.
Okay, for 2 years.
So Habib is a very good choice.
Yeah. So next Thursday, we have this presentation by Habib Abla on aligning the global focus areas with the local needs. So he's going to make the presentation that day. Narendra Bhandari ji is going to be the chief guest that day. All of you, please come.
We were discussing the next presentation, both of us, Habib. We were in Jordan last week. So we have some free time where we discussed about it. He's ready. No worries.
Excellent.
He's ready.
You are there to support, guide. Okay, then. Good night.
Yeah, nice to see you, Nabil. After some time, nice to see you, Nabil.
It is my joy, Jayanti. It's my joy to see you healthy and in good shape, always.
Good, good, good. You look good too.
I learned a lot from you.
Oh, so kind of you. Actually, nagaRAJU, I want to say about something else. Someone of my multiple was saying that he regularly attends the Skill Up. Now, he also puts his membership number. But, he was saying that his name doesn't appear on the attended list anywhere. So, do you do it?
I'll tell you the background to it. When I was the district GLT coordinator, I had access to report attendance as well as the faculty members of all the programs that I organized. So because I had access to that, I used to report hundreds of people by taking their membership number and all that. It used to take me quite a lot of time, but I thought it would help them in the long run. Once I'm no longer the GLT coordinator, I cannot report it.
I see. Okay. But even if you were GLT coordinator of your multiple, you could report all over India or ISAME?
For all my programs, for all the programs that I conducted or organized.
Okay. Right. But now you cannot do any longer.
I cannot do that.
I see. Right. Okay, I'll convey to him.
Many people ask me this question.
Okay.
Because whenever they go to the Learn portal, they can see their name.
Yeah, because some people are sensitive to this Learn record. Not all people are, but some people are. Yeah. Okay.
Okay. Good night, everybody.
Good night, sir. Good night.